Hello and good evening, everyone. Happy Pride. Thank you all so much for being here tonight to finish Pride with us with the American Cancer Society Cancer Action Network. I'm excited to be here with you all. I wanted to first welcome our current ACS CAN members and volunteers. Thank you for being here with us and showing your support in the cancer fight that includes focusing on inequities in the LGBTQ community. I want to also give a huge shout out to those of you who are new to advocacy and ACS CAN today. I hope you get a chance to meet some other like-minded individuals at the tables before we started, and you'll also have an opportunity to do that a little bit later on. First, I wanted to see if you could raise your hands if you were here because you signed a petition at a Pride event, or if you're one of our normal volunteers that are here. Either way, we're happy to have you here, but you can use your little emojis here at the bottom of the screen. You can just raise your hand. We'd love to see who's here. And also, if you just want to go ahead and start putting in the chat where you're from, we'd love to learn where everyone's from. First, I'll start here with myself. My name is Michael Myers, and I'm a volunteer for the American Cancer Network. I use the pronouns he, him, and his. I'm in Pennsylvania. I've also been a volunteer for the American Cancer Society Cancer Action Network for just about 11 years or so now. I definitely got involved with ACS CAN just because I love the work that they do and how they're making a difference. Unfortunately, we all know people have been diagnosed with cancer. The first person I can remember being diagnosed with cancer was my aunt when I was real little. I didn't even know what cancer was, but unfortunately she didn't survive. And as I continue to grow older and older, more and more people have been diagnosed with cancer, friends and family. And I'm just tired of seeing people be diagnosed and have to fight that battle, some winning and others not so much. But I'm here to make cancer a priority, and so no one has to fight alone. But I'm really excited for my newest role, which is a volunteer role leading the new LGBTQ plus and allies engagement group. This is a new initiative for ACS CAN, and I'm proud to be part of this and the progress that we're making so far. And we'll share a little bit more about that group with you later on tonight. So get ready to hear more about that. Tonight, we hope that you each leave feeling a little bit more hopeful. Hopeful that we can be part of fighting cancer, and hopeful that we can close the gap on health disparities in the LGBTQ community, and hopeful that your voice will be heard. We plan to have a little bit of fun tonight, so we'll get ready with that in a little bit later. But we also really want to make sure that you feel that you can be more engaged with ACS CAN at the end of the evening. And speaking of fun, we're excited to have a very special guest with us appearing by video tonight to give us a warm welcome. I'm pleased to introduce Miss Faith Michaels, a fabulous diva joining us all the way from Key West, Florida. Thank you so much, Faith. That was so much fun. And since it's a party, we wanted to sprinkle little party games throughout the event. So let's get our trivia hats on. I'm going to read the trivia question, and then we'll post it up here on the screen and in the Q&A box. If you think this statement is true, just go ahead and give it a thumbs up. Our first question is, men who identify as gay who smoke are more likely to smoke cigarettes than men who identify as straight. So let's see, do we think that's a true statement or false? You're going to go to the Q&A tab here to go ahead and play. Do we have any thumbs up? Do we think that's true or false? Let's see, I think some people are putting it in the chat here too, but you're right. That's right, it's true. Men who identify as gay are 10% more likely to smoke menthol cigarettes than men who are not. It's an interesting fact, and that's why we're working on the menthol ban with the FDA. So there we go. We'll have more questions for you a little bit later to keep that thing going. But for now, it's my pleasure to introduce Lance Barber. Lance is the Director of State and Local Campaigns focused on health equity. He's going to share with us a little bit more about what ACS CAN is and what we can do to impact cancer policy. Lance?
Thanks, Michael, and welcome everyone. It was a privilege and an honor to be with you all tonight. As Michael said, my name is Lance Barber, and my pronouns are he, him, his. I know that many of you are brand new to ACS CAN, so it's my job tonight to tell you a little bit about who we are and what we do. ACS CAN is the advocacy arm of the American Cancer Society. Our goal is to reduce death and suffering from cancer in this country, and this cannot be done through just research and public awareness alone. We also need policy change. We believe that everyone should have a fair and just opportunity to prevent, find, treat, and survive cancer. It should not matter where someone lives, how much money they make, the color of their skin, their gender identity, their sexual orientation, or their disability status. Our ACS CAN volunteers help to end the suffering and death from cancer by educating and building relationships with lawmakers at the local, state, and federal levels. They share personal stories to help lawmakers understand the needs of cancer patients and their families, and work in teams to ensure that lawmakers are doing their part to reduce the burden of cancer. I will be sure to circle back on that story section in just a few minutes. Here at ACS CAN, we are completely nonpartisan. Taking the sides politically is a distraction from our goal, and we are proud to have legislative champions from across the political spectrum. The only side we take is the side of cancer patients and their families. We do not endorse candidates or political parties. We have one goal, and that is to eliminate the death and suffering from cancer for all people. You can go to the next slide. Now that we have the formalities out of the way, I want to get back to storytelling for just one minute, because storytelling is so critical to the work that we do. We all have a personal story related to cancer, as you just heard from Miss Faith. Whether it's your own story or that of a family member, a friend, or a work colleague, we all know that someone who has personally been impacted by cancer. These stories are crucial for policymakers to hear and to understand, and truly, they are our superpower. Lawmakers hear about legislative proposals all day long, but when we can show them how our proposals can improve the lives of real people who live in their district, we win. I once was the government relations director in Louisiana, and there was a senator who would always tell us no. No matter the facts that I brought to his office, no matter what type of fact sheets, no matter what I did, he was always a no on most of our issues. It wasn't until one day where I brought someone from his district to share her personal story, to share how the policy impacted her life, and then he turned to a yes. When I finally heard that he was a yes, I immediately went to his office to figure out what changed, what happened, how did you see the light? And he told me, he said, it wasn't until the young woman came and sat in front of me and told me exactly what she goes through. And then that's whenever I could really connect the dots to understand the policies that you guys were pushing. And just like you all, for me, this is personal too. I have, like you all, been touched by cancer as well. Most recently and currently on my mind today, as I share with you all, is my mother-in-law, Susan Little, who passed away from breast cancer, my uncle Julius Straps, who passed away from esophageal cancer, and our dear friend and colleague, Mark Kaplan, who passed away from prostate cancer. I share my reason for being here because I bet it is a lot like yours. We are all in this together, and I promise that by joining together, we will make a difference. I wish I could hear all of your stories, and I hope to one day that we can. But in the meantime, it would be really inspiring if everyone could share the name of one person that motivates them in the fight against cancer today. Please put that name in the chat box. Seeing the names of your loved ones not only reminds us of why we are here today, but also brings us together in a united front to reduce the burden of cancer. Now I'm going to tell you a little bit more about the policy work that we do and how you can get involved. As a science-driven organization, you can go to the next slide, but as a science-driven organization, it is important to ACS CAN that we put our resources where we can make the biggest and most lasting impact. We also know that eliminating cancer disparities will bring us closer to achieving health equity and reducing death and suffering from cancer for everyone. Research shows that there are 3 key strategies to get us there. The first, access to care, ensuring that all people can get access to the care that they need and when they need it, that their insurance status, their geography, or their bank account does not stand in the way of that care. Number 2 is accelerating cures. The federal government is the largest funder of cancer research. We must make sure that this investment continues and even grows for the treatments to become available. And third, and last but not least, is improving tobacco control. Smoking is the single largest contributing factor to cancer in the United States. We must do everything in our power to stop kids from accessing tobacco products and provide greater resources to help adults quit. All three of these policy areas are critical, but I'm wondering if there is one that you are particularly interested in. Please put in the chat box which one is most important to you and how you would like to get most involved. And with that, I will turn it back over to you, Michael. Thanks for allowing me to be with you all here tonight.
Thank you so much, Lance. And it was great to hear some of those examples. If you have any questions about our work or questions specifically for Lance, you can go ahead and put those in the Q&A. We'd love to get those answered for you. I think it's time right now for a little bit more trivia. I'm going to ask you another trivia question. It'll be here on the screen, and we'll put it in the Q&A for you to take the kind of poll. So the question is, lesbian and bisexual women have a higher risk of breast cancer than those who identify as straight. Do we think that's true or false? I see some trues coming through, some thumbs up. What do we think? If you go to the Q&A, you can put your vote in there for yes, or you can put it in the chat. What do we see here? I think we got a couple trues there, but that's right. Sadly, these women are at a higher risk for breast cancer. Let's do another question. How about adults who identify as transgender are more likely to smoke daily or occasionally than those who do not identify as transgender? What do we have? What do we think? Is that a thumbs up? Is that a true statement, or do we think that's false? There we go. We got some thumbs ups coming. That's right. Unfortunately, transgender adults are 9% more likely to smoke than non-transgender adults. All right, now I'm excited to introduce Dan Tracy. Dan is a leadership volunteer from Massachusetts and is a member of the newly formed LGBTQ+ and Allies group. Dan?
Thanks, Mike. Thanks, Michael. First of all, and thank you all for joining us again tonight. It's a pleasure to be here. My name is Dan Tracy. My pronouns are he, him, his, and I'm the vice state lead from Massachusetts. What drew me to volunteering with ACS CAN in the first place? The truth is, there's no one reason. The pushing for new innovative therapies, expanding access to healthcare, the connection to patients, all of it is basically sums up that ACS CAN was made for me. The connection to patients is, unfortunately, like Michael said earlier, we all have our stories. One of mine is one of my best friends, Becca, was diagnosed with ovarian cancer at only 26. And at the time, she struggled to find which insurance plans would actually cover her treatment. She continued to struggle over the past couple of years because in the pandemic, she lost her job and she worried about how she was going to pay for her follow-up appointments. Luckily, she's now beyond her last chemo treatment, and she's actually doing things that we should be doing too. Like, she's leading a makeup class for teen cancer patients that are led by drag queens who know the makeup the best. It's that will and drive to impact people's lives that is instilled in all of our ACS CAN volunteers. And it's that reason that I'm proud to call these people my family. Now, I also want to tell you why ACS CAN is focusing on the LGBTQ+ community and what one way we hope to address the inequity, the unique issues that we face. Many of us know, and research confirms, that LGBTQ communities suffer from a lack of representation in simple things like data collection. This lack of representation extends to research, clinical trials, cancer screening campaigns, accessing healthcare, and having culturally competent healthcare providers that you can trust your care in. And there is a reason to believe that the LGBTQ folks are carrying a disproportionate cancer burden due to research that confirms a unique cluster of risk factors like tobacco and alcohol use, poor mental health, obesity, and many other stressors. As part of ACS CAN disparities and building a more diverse and inclusive organization, We recently formed the LGBTQ+ and Allies Engagement Group. I'm so happy to be part of this amazing team of volunteers. The LGBTQ and Allies Engagement Group provides the learning, strategy, and idea exchange for ACS CAN volunteers that are working to increase awareness and advance policies concerning cancer disparities facing the LGBTQ+ community. And Leslie actually just put in the chat the link to our website. One recent example of what we're working to do is providing guidance and support for ACS CAN's engagement in Pride events throughout the country, including tonight's event. While the conversation may start at a Pride event, just know for a fact that ACS CAN is here year-round, fighting for health equity for everyone, including the LGBTQ community. The bottom line is myself, the engagement group, and everyone at ACS CAN wants to work together to ensure that everyone has a fair and just opportunity to prevent, find, treat, and survive cancer. Thank you so much, and happy Pride. I hope you enjoy tonight. And with that, I'll hand it back over to Leslie.
There I am. Sorry about that.
Oh, there's Leslie. Awesome.
Thanks, Dan. I have the honor and pleasure of getting to work with Dan and Michael and many others on the call today on the phenomenal LGBTQ+ and Allies Engagement Group. So I want to say buenas noches a todos. My name is Leslie Ferreira, and I use the pronouns she, her, and ella, and I am the Associate Director for Grassroots Alliance's Health Equity. Hopefully you are starting to see how important volunteers are to our work. We literally could not do what we do without them. As someone with a story to share and a passion for fighting cancer, you come to the table with everything you need. We give you tools and teach you the rest. As a volunteer, we don't expect you to be an expert in all our policy areas or tactics, but I did want to share a few ways that we advocate. Email. Yes, email is still an effective method of advocacy, despite what Gen Z says, to create awareness, share your story, encourage support and/or action on the issues such as funding for cancer services or research, schedule a meeting, send an invitation, and thank legislators for their support. ACS CAN sends regular action alerts on important cancer-related issues. It's a 2-click process to take action from your phone, tablet, or desktop. Social media. Most members of Congress use social media platforms to interact with and push information out to their constituents directly. Our advocates use social media in the same way to communicate with members of Congress. Social media helps with relationship building, recruitment, reach, awareness, engagement, recognition, and encouraging support for an issue such as ensuring access to quality care or expanding Medicaid. Phone calls. Legislators' offices document the number of calls an issue or piece of legislation receives, such as affordable cancer care. It's an incredibly quick and easy way to make your voice heard. In-person or virtual visits. Personal visits can have an immediate impact and leave a long-lasting impression with decision makers. You heard it firsthand from Lance's story. District office meetings serve as a great way for local advocates to connect directly with legislators and ask for their support on issues such as biomarker testing coverage. Letters to the editor. Did you know 80% of senior congressional staff agreed that a constituent written letter to the editor, or what's known as an LTE, was directly influential to the decision-making process in Washington? Submitting LTEs that share your personal story or connection to an issue is a great way to move the needle on a policy issue. Nothing can motivate a member of Congress quite like seeing an important issue like access to the HPV vaccine come up in their hometown newspaper. And we can help you every step of the way write an LTE. Media interviews, a great way to inform the public and decision makers about important issues. It offers a way to tell your story and moves people to learn more, donate, and take action on issues like strong tobacco control policies. Cancer Action Days, a day or sometimes a week of action where cancer survivors, caregivers, and their families from across the state gather or rally to call for specific action from their legislators. And Sharing your story is the thread that runs through all of the channels I mentioned above. By sharing how cancer has impacted your life, you will help make cancer a top priority in our state houses and on Capitol Hill. Have you ever participated in any of these tactics with ACS CAN or another organization? Have you taken action? Let us know what you've done in the chat box. Now, I have the pleasure of introducing my colleague and one of my favorite people, Rachel Erdman.
Wow, thank you so much, Leslie. That is quite the introduction. I really appreciate it. I am really happy to be here with you all tonight. I am Rachel Erdmans. I am part of the grassroots engagement team. I do she, her, and I just want to talk to you a little bit now that you have sort of a better sense of who we are, what we do. I want to share a little bit more about how you might get involved as an ACS CAN volunteer, because we would love to have you as part of our Fighting Cancer team. So first, I want to assure you that we have a volunteer structure in place for leadership. So we make sure that you have the support you need to do all of those awesome things that Leslie just talked about. So I think if we can bring up the slide. Excellent. This is just a photo of sort of our volunteer structure. And so you can see each state has a lead volunteer. Some of those folks are here today. I know Dan mentioned that he was a vice lead volunteer. And then we have those folks are there in red. And then every single congressional district in the United States has a leader as well. And you can see those folks in yellow. And I'm sure some of those people are here. If you do the little thumbs up emoji, we can see that you're here. And so the rest of our volunteers are those folks in blue, and we call those our legislative ambassadors. And the legislative ambassador is just what I want to pitch to you tonight. It is just a great place to get started volunteering with us. It's a great way to dip your toes in, see if this is for you, see if, you know, where you kind of have some skills that shine. And so I would just love for you all to, after this call, if you're not already involved, sign up to be a legislative ambassador. And so if you go to the next slide, this is just like some typical things that our legislative ambassadors do. They, you know, I think you're going to hear from all of us. You heard from Lance. You've heard everyone share their story. That sharing your personal cancer story with elected officials is super, super important. Responding to ACS CAN action alerts. So now that you're kind of in our system, we obviously emailed you to invite you here tonight. You will receive action alerts about different campaigns, and we'd love for our legislative ambassadors to take action on those if they're things they're passionate about. Participate in advocacy trainings and our annual Cancer Action Days, where we, you know, go to our state and federal capital and get to know your lawmaker. I'm going to guess that many of you maybe already have relationships with your lawmakers for other causes you're involved in, and those relationships are really valuable to us. And then help find other people, right, that are want to get involved or anxious to fight cancer as well. So Leslie put in the chat for me what you can do to sign up to be a legislative ambassador. It's pretty simple. You go to our volunteercommunity.cancer.org. You filter by ACS CAN, put in your zip code, update those results, and then you'll see right where you can click and get your information in. That'll put you right in the system. Someone will call you, contact you, email you to make sure that we get you right into the fold. So finally, next slide. All right. So, right, it's not a party without games. And we have a really fun way for you to begin sort of your cancer advocacy work. And it is to complete this bingo card that you see here. It's not as fun as like drag queen bingo, but it will be pretty fun and you'll be fighting cancer. So we'd love to have you all take a look at this bingo card. It has a lot of different ways that you can just kind of, again, tip your toe in to cancer advocacy. When we send out a thank you for attending tomorrow, you will simply download this, complete 5 of the actions, you know, down, across, diagonal, and you will win a really cool ACS CAN Pride laptop sticker. And so you'll have till July 31st to turn that in. We're going to put right here in the chat, and it'll be in the thank you email tomorrow where you submit your a photo of your bingo card. You can just, you know, save it right on your phone, use the markup to mark off the bingo. So it should be pretty simple for you to work toward that awesome prize and start taking action. So the great news is that becoming a legislative ambassador will really help you on your bingo card. So that is really important. And I don't know. One thing that I always say about volunteering with ACS CAN is that the work is both impactful and fun. And so we hope that you are a group of people who want to make an impact, but also have a really good time. And if that's you, then we are the organization for you to get involved with. So I'm going to turn it back over to Michael. He is going to share a few photos that illustrate some of the fun we've been having this month in particular. And maybe some of you will even recognize these.
Perfect. Thank you so much, Dan, Leslie, and Rachel. I appreciate you guys being here and sharing that information with us. And as Rachel said, while we're all here together, I wanted to take the time to share some pictures from the Pride activities that we've taken place around the country. I know we have some pictures from the Massachusetts Pride where Vice SLA Dan Tracy was there. So raise your hand virtually if you were able to attend that event with him. I know they had a great time there. What about Seattle? Anyone attend the Seattle Pride this year? I know we were there. So we were proud to be in Seattle as well. That should be on the next one. That's our next picture. And then the one after that, we were in Oklahoma. I know, was anyone out in Oklahoma? I know we did a great time out. We had a great time in Oklahoma. And then what about New Jersey, Ohio, and Tennessee? You know, we made an appearance at those events as well, and we were proud to be there. And I know we were at many other events. We have a handful of other events coming up throughout the summer because we're going to celebrate Pride all year long, not just during June. So regardless of where or whether you attended a Pride this year, I just want to thank you for taking the time tonight to be here with us tonight. We do have one last fun surprise for you. When you registered for the event for tonight, you were asked to share your favorite party song. And we took that opportunity to create a Spotify playlist as a party favor for you all. We'll put that link in the chat box, and we'll hope that you'll be able to jam out to that when you to go back and remember tonight. And then I'm just going to leave you with this last one thing. Just remember that cancer impacts everyone, but it doesn't impact everyone equally. ACS CAN is committed to doing something about this, and health equity and access to care are the pillars to guide our work. Please help us fight back by completing that bingo card that you'll soon receive by email tomorrow, as Rachel had said. But now it's time to finish the party with one last game. We're going to go back into the room with all the tables, and I want you to navigate to a table with 8 folks to introduce yourself. And we'll introduce yourself by sharing who you are, where you're from, your preferred pronouns, and what motivated you to attend tonight, and your connection to cancer if you're comfortable. And of course, your favorite part of Pride. And then after that, if you want to stick around and play 2 truths and a lie with the folks at your table, that would be great. If you decide not to stick around, we really do appreciate you being here with us tonight. And I look forward to working with all of you as we continue the fight against cancer. Thank you so much. All right, we should be headed back to those tables shortly.